Now I should talk about the Epistop. Yes, okay. Uh, I have, in fact, not so many results from Epistop to present you, because now we are just in the stage of preparing the results, of working very hard on the results, on combining different results together. So, but I'll do my best. So there are my disclosures. And tuberous sclerosis is regarded currently as a very good model for epileptogenesis studying. Just in the beginning of August, we had NIH workshop in Washington, just discussing about the future concepts and future studies for epileptogenesis, and it was widely recognized that tuberous sclerosis is very good model for this analysis in humans. Why? Because epilepsy is very often in 90% of patients with tuberous sclerosis. 71 or about 70% of patients develop seizures in the first 2 years of life. There is known genetic defect. There is known morphologic substrate of epilepsy. There is a significant number of epileptic comorbidities, and there is possible prenatal diagnosis. So now we know that the epilepsy starts not with the clinical seizures, but starts far beyond, far earlier, before clinical seizures. Probably in tuberous sclerosis patients, it starts with the mutation, and we may observe a disorganization of the cortical layers. And soon afterwards, it is the beginning of different processes in the brain which are leading to clinical seizures. And here we may have clinical seizures, and we usually start to treat those patients. In 2011, we published our preliminary results about the preventative treatment in the group of 14 patients who from neonatal period or from the first months of life had this EEG, video EEG done every 4 to 6 weeks, and in whom we started to treat with vigabatrin as soon as we may activity on EEG. And we had much better results to the standard treatment group. It was a historical group in whom we had in this preventative group, we had much lower patients with the drug-resistant epilepsy. We had much better results with the epilepsy treatment. And what was the most important for us, just the much lower incidence of patients with severe forms of developmental disability. And just 2 years ago, also Americans published very similar results. It was not the preventative trial, in fact, but they did the evaluation of the usefulness of video EEG as a biomarker of epileptogenesis. And in the group of 28 patients, in whom they enrolled patients before 7 months of life, and they did this EEG every 4-6 weeks since then, and until 24 months of life. And again, they had a group of 9 patients with normal EEG through the whole period of follow-up who didn't develop epilepsy, these white bars. They had 5 patients with normal EEG who developed epilepsy, and they had 14 patients with abnormal EEG who finished with the epilepsy. So the conclusion was that all patients with paroxysmal EEG developed epilepsy in this group. So the conclusion was that video EEG could be a good biomarker of epilepsy development in this group of patients. Now they are preparing another manuscript. It is now in the review and probably soon be published. It is about the correlation between those who were observed with the epilepsy in the end of the follow-up and with no abnormality on EEG or epilepsy which was relatively soon stopped, and those patients had much better development. Just I would like to show you very small video about Epistop.
A genetic disease. and so was Junior here. Junior's TSC causes benign lesions to form all over his body, even in his brain. Apart from these lesions in his brain, he also has epilepsy and autism, which has an impact on his daily life. That's why Epistop was founded. Epistop is a long-term prospective study aiming at a better understanding of epilepsy and its consequences. Within this project, 16 universities and hospitals from Europe, Australia and the US are working together. Like some of his fellow patients, Junior's TSC was detected in the womb. The ultrasound showed a heart lesion as the first symptom of TSC. A fetal MRI showed the brain lesions. After birth, an EEG confirmed his epilepsy. Epistop is determined to find out if treating Junior before his first clinical epileptic seizure will delay or even prevent the development of seizures, ultimately trying to make sure he and his fellow patients can enjoy a better quality of life.
Yeah, but in fact, the preventative treatment is just the first aim of the project. We have also another aim. It is prospective analysis of clinical and molecular biomarkers, genes and proteins expression in the course of epileptogenesis. So we started in 2014 and we should finish in April next year. So the summary meeting should be on the 4th of April in Poland. And the inclusion criteria was tuberous sclerosis diagnosis, patients younger than 5 months of life, seizure-free and not anti-epileptic drugs, no anti-epileptic drugs at the enrollment. And we enrolled patients till 2016, and we planned to enroll 100 patients. And it was a randomized trial. So finally, we managed to enroll this 101 patients. And last visit was in September 2018. And there is a group of 9 clinical sites across Europe and also in Australia who enrolled patients. The most interesting and very challenging part of the project is just the analysis of molecular biomarkers of the study, because for the first time as a neurologist we have access to the biological material before epilepsy, in fact. So we are collecting blood for different analyses at the enrollment. So sometimes it's a newborn, sometimes it's a patient below 4 months of life. The second collection is abnormal EEG. The third collection is at seizures, and the fourth collection is in the end of the follow-up. And there are different work packages. We have a work package on EEG with Liebenlage. We have molecular work packages. It's work package 3 and 5. We have a neuroimaging work package. We have a clinical trial work package and neuropsychological work package with Paolo Curato as a leader of this work package. There is a set and battery of different molecular studies we are able to do due to gratefully to this European project. And there is a list of different molecular studies which will be done. Whole genome sequencing of peripheral blood DNA. We have 5 molecular basic science labs working with us. Deep next generation sequencing, expression RNA profiling, microRNA profiling, proteomic profiling, and some metabolomic profiling done in the United States. And so there is a lot of list of interesting issues, questions we raised for this project. Of course, is it confirmed that early seizure onset is a negative predictor of cognitive behavioral outcome? I think we know the answer at this moment, but still it will be maybe confirmed. Are infantile spasms associated with worse cognitive behavioral outcome? Are seizure controlling or high seizure frequency associated with cognitive behavioral outcome, and how much? are EEG pattern-associated cognitive behavioral outcome. Does preventative treatment positively influence cognitive behavioral outcome? So it was the first aim of the main aim of the project. And the correlation with work package 7 and work package 4, MRI studies, and the correlation of these studies with mental cognitive development of the patients. Also a very interesting DTI analysis will be done here by Flor Jansen. Just 2 slides just to show you a little bit the results of the Epistop trial. It was done 6 months ago, and there are preliminary results prepared by Paolo Curatolo. And you can see the development of different spheres in our patients at the 6 months of life. At that time, we had 64 patients analyzed, and different spheres. And you see that this child, this infant at 6 months of life, the worst development was delay. It's here. So it was motor development. So floppiness, it was more pronounced in these patients comparing to the other spheres. But when we are talking about 24 months, still, unfortunately, language. So it is poorly developed in this group of patients. So it is, there are results only from the work package 7, but these results will be combined with neuroimaging studies, also with other studies, EEG studies, so we will see. And there are some consequences and results of the Epistop which may be very interesting and may go far beyond the Epistop, new challenges, identification of other groups of children with high incidence of epilepsy and poor outcome for early intervention studies, validation of molecular biomarkers identified in Epistop in other groups of patients, maybe patients with Sturge-Weber syndrome, for example, opportunities for different types of EEG biomarkers, seizure prediction, ectolocalization. We know that there are new techniques in EEG techniques which could be useful for that. Is each epilepsy syndrome going to have specific biomarkers? I think yes. Are the biomarkers age-dependent? It's even more complex question, more difficult probably to answer. So in the end, I would like to thank our patients and also the group of Epistop researchers. Thank you very much for your attention.